Hi, I'm Dr. Kelly Wallace with Catawba Heights Animal Hospital, here to talk to you about your dog's blood work. Um, why might my dog need lab work? Every dog needs blood work once a year. Blood work tests for your red cells, white cells, liver, kidney. It tests for heartworm disease, tests tick-borne disease, fecal parasites. It also checks for urinary tract infections, crystals, for your dog's health. What are the different types of lab work veterinarians can call for? There's a urinalysis, which is your dog's urine. It looks at the kidney function. It looks at crystals, infections. It looks at proteins. It can also see if there's sugar in the urine to help with possible diabetes diagnosis. A fecal exam looks for parasites in your pet's stool. So hookworms, roundworms, whipworms, tapeworms. We can also see other parasites like coccidia and giardia. A CBC, or a complete blood count, looks at your red cells, your white cells. It looks at the size, shape, different types, immature versus mature type cells. It looks at platelets as well. Clotting times can help, especially if your pet is bruising very easily, or if your pet got into some poisons like rat poison. Those can help us let us know if clotting times of the liver has been affected. A blood chemistry, which is a biochemical profile, or a blood chemistry, looks at your liver, your kidneys, your proteins. It can look at the pancreas. Looks at all your organ functions inside. Cytology can look to see what type of cells or infection you might have, like an ear cytology will look for an infection, whereas a cytology or an aspirate of a mass might lead us to know what type of mass that your pet has that we've aspirated. And then gastrointestinal blood panels, our GI panels, can look to see what kind of possible issues might be underlying that's causing your pet's diarrhea. Is it a maldigestion, malabsorption? Is there a pancreas issue? That kind of thing. How does my veterinarian decide what lab tests to order for my dog? First, it depends on age. Dogs under 7 years of age, we typically do what we call a young or a small panel. Over 7 years of age, because we typically see more things as pets get older, we order a large or a senior panel. That's also going to include your thyroid, because dogs are prone to hypo or underactive thyroid as they get older. When will a veterinarian recommend blood testing? We recommend a blood test by 6 months of age, typically before a spay or a neuter when we fix them, and then we recommend it once a year. Some pets, as they get older, we recommend it twice a year, and then maybe additional testings that we do throughout the year in case things start to crop up. Like if we suspect thyroid, we suspect diabetes, we suspect possible heart issues, we might want to add and do a cardio-pro-BNP, even though we've done it previously in the year. Things can change quickly with your pet, especially as they get older. So a lot of times we recommend blood work as things crop up. We do recommend and require blood work once a year for pets that are on chronic long-term medications to make sure the liver and kidneys are functioning well, as most medications are metabolized by the liver and excreted from the body through the kidney. So if we have to make sure those are functioning correctly, if not, we can easily hurt your pet with medications. What will blood work tell me and my veterinarian about my dog's health? It'll give you an overall look into your dog's health. If there's any concerns with liver, kidney, heart, if there's an infection, if there's a parasitic infection, how their urine looks, do they have a UTI, do they have any parasites? What is baseline lab tests? How does baseline lab tests benefit my health of my dog? One, it gives us something to compare to. A lot of times pets will come in sick and we don't know, and they might have high kidney values, and we can't tell if the kidney values are high because the pet is sick, or if they've been high and they have an underlying chronic condition we didn't know about. So by having baseline blood work, every year, we can see and compare things to see what trends there are. What can blood tests for dogs help identify? They can identify heartworm disease, tick-borne disease like Lyme disease or Ehrlichia, kidney disease, liver issues. Certain liver enzyme might be elevated. We could be talking about Cushing's disease. If your dog has chronic anemia, that could lead us to think that there's a chronic condition going on somewhere that may not show up in blood work. Like a lot of cancers don't show up in blood work, but you might see a chronic low-grade anemia, and that's when we have to go looking elsewhere with like an ultrasound. Blood work gives you a good window look into your overall of your pet's health, and certain minor changes could mean a lot in us finding something early rather later when it's more advanced. What should I do if I'm having trouble understanding my dog's blood test results? Ask questions. Uh, Ask questions, call us. We will, you're never going to bug us. We want you to understand so you can make the right decision for your pet. Do your research. You can get on the internet, use reputable sites, but, ask questions. And sometimes speaking to different people helps because some people can explain it differently in a way that you understand as compared to the first person you spoke with. What do chemistry means for my dog's blood work? Chemistry tests for your organ function. So it's going to look at liver, kidneys. It's going to look at glucose, electrolytes, proteins, which are your overall metabolic status. Blood work costs anywhere from $100 to almost $300. As we get older and need to test for more, the cost does go up. But we're testing for more and we're getting a bigger, better picture of your pet's overall health. What can I expect when my dog is getting blood work done? You should get the results in 3 to 4 days. We will pull blood from your dog, and sometimes that is a stressful event. We try and make it as stress-free as possible. And if your pet is a pet that we have sent home medications before to help ease with appointments, please give that medication. While you might think they'll do fine here, when they get here, the adrenaline's pumping, other dogs are barking, their sight smells, and they're being, strange people are coming at them. Give them the trazodone or the gabapentin. It will help overall with that visit. Is having lab work done for dogs painful? No. I mean, it's a simple injection, a stick with a needle, which does have a little bit of discomfort to it, but overall, it's a very minor discomfort for the overall benefit of your pet. What if my veterinarian doesn't have an in-house lab? We do have an in-house lab, but for routine, healthy blood work, we send it to our outside lab. It's more cost-effective for the owner, and we get more results at a cheaper price for the owner. Running it in-house is more costly, and we're more limited on what we can run. Typically, if your pet is very sick, we will run it here because we know we're looking at specific things. But like thyroid, heart, different kidney values, liver values, those are best run at the lab as they run more tests. We're more limited here, but we do have the ability to run things in-house for those sick pets that need it right away. If you have any questions regarding your pet's lab work, give us a call at 704-827-0616.